I'm Rebecca Shore. I'm one of the 3 doctors that are doing weight loss surgery here at Haywood Hospital. All 3 of us, myself, Dr. Rebecca Shore, Dr. Roy Shen, and Dr. Corey Campbell, are fellowship trained in weight loss surgery and beyond our learning curve. We welcome you to the Weight Loss Center. The idea of a weight loss center in the state of Massachusetts is that it isn't just a place for surgery, but that prepares and supports the patient for their surgery. So here at Haywood, we have a comprehensive center where you will meet with a dietitian and work with a mental health provider and learn how to count your own calories and journal, what's healthy exercise, and be best prepared for your weight loss surgery. We also have support from the medical staff. If you do have a heart condition or an issue with breathing, we may ask you to see a cardiologist or a pulmonologist prior to having surgery, and everybody is here to take care of you. We're going to move on to the next slide. So how do you qualify for this surgery? So in order to qualify for this surgery, you have to have an elevated body mass index. And we can help you calculate this, and it's based on your weight and your height, and a body mass index of 40 will qualify you for the surgery. People can also have surgery at a lower body mass index of 35 if they have sleep apnea, diabetes, or high blood pressure with 2 medications. This is a table demonstrating a patient with a body mass index of 40. This person is 5 feet 4 inches tall and weighs 230 pounds. There are such calculators on the internet, but if you need help, we will help you calculate your body mass index to make sure you can qualify for the surgery. The disease of obesity in the United States has been issued for many decades. Currently, 35% of adults in the U.S. are obese, and we're probably only operating on 1 to 8% of those people. 17% of American children are obese, and this is predicted to continue to increase. We have seen a slight decrease in children from 1 to 5 years old, but otherwise we have not made any headways in the other groupings. Part of our sedentary lifestyle, part of it is genetics, and part of it is the rush of life and the foods that we choose. When you suffer from obesity, there are other medical problems that can affect your health that are related specifically to the weight, and when we correct the weight, we see those improve. This diagram just shows you a few of the things that improve with the loss of the weight. Some of the things that we know about obviously are fatty liver, sleep apnea, diabetes, high blood pressure, high cholesterol, but even cancers go down when you decrease your weight. This is a demonstration of what percentage of those medical problems will resolve when you have weight loss surgery, and it's quite impressive. We see type 2 diabetes go into remission at a 95% rate, and we see symptoms from osteoarthritis improve. People who were certain that they needed a joint replacement sometimes are happy without it. We see the heart ejection fraction improve. People come off of their blood pressure medicines. Sleep apnea can be retested at 6 months after surgery to see if it has resolved. Stress incontinence. GERD is heartburn. It's very nice to see heartburn resolve after weight loss surgery, and also cholesterol medications can sometimes be stopped. So why surgery? So we do know in the United States that diet and exercise alone are not successful for our patients. So the FDA has approved weight loss surgery as the only means for sustained weight loss. And this is just an example of the NIH consensus statement, and I'll just read it out for you. Permanent weight change is almost impossible for the severely obese by means presently available with the exception of surgery. And so this just goes to the statement where people are telling you that you're taking the easy way out. It is actually the only way out. And so you should be reassured that even the National Institute of Health believes this is the best choice for you. So we talked about the body mass index and the indications for surgery. And also we have to prove that you have attempted diet. So we work with you with a dietitian and make sure that you know how to count calories and how to lose weight. The surgery has to be performed at a center like ours. And you have to be able to submit and commit to lifelong surveillance. Once you meet those criteria that we showed on the last page, we prove that there are no medical causes for your weight. We have you meet with our behavioral health specialist to make sure you're ready to cope with the changes after the weight loss surgery. If you've had a problem with drugs and alcohol, that has to be 1 year out, and you have to quit smoking. The whole team has to decide that you have completed all of our set goals, and then obviously dedicate yourself to this lifestyle change. So we offer the gastric bypass and the sleeve gastrectomy here at Haywood Hospital. Gastric bypass forms a small pouch which restricts the volume of food you can eat, and also it increases your metabolism so that you burn calories faster. The sleeve limits the amount of food that you can eat. This is a picture of the sleeve gastrectomy. Some people call it a banana, although it turns out it's more of an Italian boot. But it allows the food to make you feel very full with just a small portion, and the anatomy is still maintained. The portion of the stomach that is excised with a stapler is removed from your body and sent to the pathologist. So this is not a reversible surgery. There's no reshaping or changing of the anatomy of your small bowel. So reoperations for bowel obstructions are not seen in this grouping, so it has less reoperations. The sleeve has less concern for nutrient deficiencies, no bleeding ulcers, no internal hernias, and you can still have an endoscopy if you have any problems with gallstones in the future. Obviously, and the disadvantages is that the specimen does go to pathology and cannot be replaced back into your body, so it is not reversible. The long-term weight loss data is accumulating, and it does appear that it'll be a little less weight loss than the gastric bypass and a little more weight regain. The gastric bypass, so the gastric bypass has been done since the 1960s, so this data is available for many decades. It's still the same surgery, although now it's laparoscopic instead of open back in the 60s. We create a small pouch and we redirect the nutrients so that they're absorbed later on down the GI tract. By doing this, it restricts the amount of food you can eat, and then it also increases your metabolism as the small bowel has to work harder to get that food in. When the food bypasses the old stomach, there is some issues with vitamins, but it helps really to take away your hunger. So the advantages and disadvantages of the bypass. It is the surgery that's been performed the longest in the United States, and the outcome data is well understood. The weight loss is certainly faster than the sleeve. It's about 10% more. People keep the weight off for longer with the gastric bypass than the sleeve. And then you see dumping syndrome. Dumping syndrome is that the small intestine is not used to seeing concentrated calories, and that if you eat something like a bag of Hershey Kisses, you will feel uncomfortable, and then you would not want to eat that in the future. So it helps changing your behaviors. The disadvantages, we are operating on the stomach and the small intestine, so we can have complications on both of these areas, both during the surgery and delayed. It It's not easily reversible, but it is reversible. There are nutrient vitamin deficiencies. A lot of people don't like to feel uncomfortable when they eat their wedding cake. Ulcers aren't possible, and obviously the reoperations aren't possible. So the results of bariatric surgery, obviously the weight loss happens with both surgeries. It is the goal of the surgery, and it helps a lot with medical problems. It improves diabetes, blood pressure, sleep apnea. If you have a gastric bypass in the United States and your BMI is greater than 40, the data shows that you'll live about 5 years longer. So that's some impressive data to tell your family about. It improves your quality of life, like getting on an airplane and nobody's worried who you're going to sit next to, being able to go to the Bruins or Red Sox game, buy clothes off the rack, get the promotion that you're supposed to get. This is just an example of how we used to do the gastric bypass. I am old enough to remember open gastric bypasses. I did do them once, but since I've been attending myself, I have only done laparoscopic cases. And so why is laparoscopic surgery better? The incisions being small are less likely to be infected, you're less likely to have hernias, there's less risk of bleeding, quicker recovery. We used to see a lot of pneumonia and clots in the legs after surgery, and it's a very rare thing at this point. So take-home points for the surgery is that I'm not a plastic surgeon. I don't consider this a cosmetic surgery. A lot of my patients do go on to have plastic surgery for their excess skin. The plastic surgeons usually like you to be a year out from surgery before they're consulted, and we do have names of the local plastic surgeons who take care of our patients. We don't consider one surgery better than the other. People have different reasons for choosing a surgery for themselves, and I like to educate you about the two choices and then have you make that choice for yourself. The surgery oftentimes is an hour long, and certainly the small part of the process. We really want you to be prepared for the surgery the best that you can. You have your one good shot at beating this chronic recurrent illness. It is not a race. And then we do offer revisions and band conversions here at Haywood for people who've had a prior weight loss surgery and have had the chronic recurrent obesity come back. So, what to expect after surgery. So we do like to see you back. It's very important for your 5-year and 10 years of success that you come to your follow-up appointments. We schedule the appointments for after the surgery with us and the dietitian to get you through the different steps of your diet. And then we like to see you several times over the 1st and 2nd year, and then every year until I retire, so I know that you're doing well. We do check labs, especially the vitamins, to make sure you don't need any replacements. And obviously I just talked about plastic surgery, but if you are a young female, we do like to try to work on yourself for 2 years before you get pregnant. And how do I get a surgery date? So these are the steps to making sure that your insurance covers weight loss surgery, and these are the appointments that we make for you. So this information session is the very first step, and then we have you come in and meet our mid-level for medical evaluation and appropriate testing. Then you'll meet with our mental health provider and our dietitian to get you started on the changes in behavior that are best for the weight loss surgery. And then we ask your primary care or specialist to make sure that they're on board and that you're in the best shape you can be for your elective surgery. You meet with a surgeon, either myself or Dr. Shen or Dr. Campbell, and then we get your insurance approval. Typically, this pathway takes about 3 to 6 months. Thank you for coming.